friends, and welcome to the special edition of the Medical Alley podcast, the show where we hear from healthcare leaders and experts across Medical Alley and beyond about the critical issues within healthcare and the work they are doing to transform it. I'm your host, Bobby Patrick, with the Medical Alley Association, and today's episode dives into an issue that is front of mind for many healthcare organizations throughout Medical Alley: disruption to supply chain and how longstanding supply chain concepts and principles are being reconsidered as the new post-COVID-19 lockdown normal takes shape. For this conversation, I'm fortunate to be joined by two experts in supply chain, Professor Shah of the Carlson School of Business at the University of Minnesota, and John Walko, Managing Director, Health and Public Service, Supply Chain and Operations at Accenture. Welcome, and thanks to both of you for being with us today.
Thank you.
Thank you, Patrick.
All right, great. So, as I mentioned in the introduction, longstanding norms and principles within supply chain are being challenged within every industry. The most visible example of this right now is within the auto industry. A recent article from the Wall Street Journal noted that auto manufacturers are rethinking the concept of just-in-time supply chain as one potential hedge against the disruption they are continuing to see from the impact of COVID-19. So, John, let's start here. You have extensive visibility within healthcare. Are you seeing a similar rethinking take hold within that industry?
Yeah, absolutely. What we're seeing is a lot of our clients, that had gone to a LUM program that really was, just in time and not a lot of backup or safety stock, are really rethinking that, in light of kind of the experience and where they ended up during the, height of the pandemic with, shortages of supplies, et cetera. So, rethinking that in terms of, how that can be deployed still, but, what are the right mix of, LUM and other methods to really track supplies. Says, it was a real challenge, I think, with folks. We had one client that had just switched to that from they had their own distribution center with a fairly large inventory in stock, and right at the height of the pandemic and back in March a year ago, had switched to a LUM program and found themselves really scrambling to figure out where the supplies were and where they were going to get alternative sources, et cetera.
Great. And so, Professor Shah, what are your thoughts here? How do you see this?
Yeah, so I think I'll build on what John said, but let's go back to the first principles about just-in-time systems and how they were designed. So remember, just-in-time systems were designed for a manufacturing supply chain by Toyota. And the basic principle was a stable demand, certainty in supply, and reliable operations, which were enhanced by co-located suppliers, which meant the suppliers were very close to the assembly lines, and very short supply chains. Now, if you think about the situation under pandemic, all of those assumptions have to some extent been violated. So we have very uncertain demand. We also have very uncertain supply. And these have also been exacerbated by very globally distributed supply chains, where the supplies for, whether we talk about manufacturing, such as automotives, or healthcare supply chains, such as pharma and medical devices, the supply chains are globally extended, which in turn means very long lead times and a lot of inventory in transit. So what it does result in are these shortages under situations like pandemic. And what John is talking about, transparency within the supply chain. So can I see where my products and components are coming from becomes very critical. Creating redundancy in supply chain. So by that, what I mean is, where is the inventory? Do I have sole suppliers versus multiple suppliers of products? Also becomes very critical. So it makes sense that John and their practices are seeing their customers, scrambling for things, unless you can create this transparency in supply chain and a little bit of redundancy in terms of alternative and substitute sources of supplies.
Very interesting. And so, building on that, Professor Shah, these changes that you're starting to see, or this desire for changes at least, are these things that are going to be here to stay? Or are these just sort of temporary reactions to, really what amounts to a once in a 100 years, or at least up to this point, has been a once in a 100 years event? And, bringing the auto industry back into it just for a second, Toyota made some changes following the major earthquake in Japan in 2011. And, and they've incorporated those along the way. So again, just restating the question, are these changes permanent or are they temporary? And then John, I'd love to hear your response, Professor Shah.
Yeah. So I think just-in-time systems are not going to go away anytime soon. So that is my bottom line kind of perspective. However, as we see these disruptions, I do believe that there would be changes that would be made to just-in-time systems the way we implement it. So Toyota was very successful because they did have transparency in their system. They did have redundancy in their supply base. They also have this certain supply and demand situation. What they did, what you're talking about the scenario, in that they had sort of lost transparency into their tier 2, tier 3 suppliers, meaning basic components, where were those being manufactured? And they kind of doubled down on it. They started to kind of look at, where their actual supplies come from, and were there common suppliers to their tier 1 suppliers. I see those aspects will be highlighted, will become more critical as we move on from this pandemic. So the lessons we can take are healthcare supply chains, I believe, will still have some component, some aspect of just in time, but this idea of transparency and visibility into their supply chain will become even more critical, whether it is via integration that John will probably talk about in terms of ERP systems and others, or other ways of integrating in terms of their suppliers, in terms of their distributors, and the entire supply chain in terms of what common inventory we hold and what are the points of storage. I think those will become very critical. But I'm curious to hear what John has to say about that.
Yeah, thanks, Dr. Shah. I would absolutely agree that, I think that there will be some kind of just-in-time system that will exist, but I think it'll look different than what it looks like today. One of the things that, we've seen, especially in health providers, is that there's been, an underinvestment in terms of, digital capabilities in this area. The ability to do, forecasting and planning, and really kind of having a good handle on, where supplies are and the visibility, what are alternative sources, et cetera. I think, what we're seeing is, the outset of a investment by many of the health organizations in these areas, so that, they have better information to be able to manage their supply chain, and, in light of, what's potentially the next black swan event that, kind of puts them back on their heels. So being better prepared, I think, will be a critical part of it. Having more digital capabilities and a more intelligent supply chain will be an important part of it. But I would agree that, just in time isn't going to go away. It's, I think, just going to look different.
So I'd like to build on what John was saying in the previous part to my answer. So I don't think stocking extra units of inventory, whether it is finished goods or work in process inventory, I don't think that is the solution. So stocking extra beds or stocking extra think of any sort of finished goods in healthcare supply chain is not the answer, because the next time we do not know what type of units or products we might need. So the idea about intelligently digitizing supply chain so we have better visibility all the way to raw material components such as API manufacturers is very critical. Another aspect that I think John brought is in terms of planning. In manufacturing supply chains, we study a lot and we actually do a lot of risk planning. So think about, where the demand, forecasting demand, as John mentioned, where the demand might come from. We have a better understanding in manufacturing. And I think those aspects can be implemented or adopted better in healthcare supply chains.
That's really interesting. And so, talking about, again, back to Toyota and using their example, the nearby location of suppliers and keeping just in time. So let's sort of take that concept and move it to, a discussion that's happening at the national level regarding, relocating suppliers and incentives to bring manufacturing back to the United States. How do you see that playing into this discussion, John? And particularly, from a provider angle, how do they play into that, and how does that discussion impact their ability to, keep a handle on their supply chain and still allow them to integrate that digital side without overburdening themselves?
Yeah, I think, knowledge of kind of the suppliers that they were depending on was something that a lot of the providers kind of lacked. And they learned it kind of the hard. Where are these places located, and how are they being impacted by the situation? Getting better control of that, and more information around that, I think, is going to be a critical part of what they do in the future. Really understanding that network and having some better real-time data about what's going on with their suppliers, I think, will also be a critical part of kind of what they do. Excuse me. We're seeing more providers also being interested in, either investing or, developing partnerships with suppliers that are on near shore, so that, they're closer and, there's, a better perception of, a more assured supply, in a black swan event in the future.
And Professor Shah, I'll ask you to build on that, and let me just add one piece to it as well. You're seeing in these other industries, all end manufacturers either building or buying their own supply chain along the way. And is that something that you see is going to continue or maybe transfer over to the healthcare space as well, or is that something that perhaps doesn't fit as well within that industry?
Yeah. That's a very interesting question and sort of the most important question, right? I mean, there is a lot of hype about nearshoring, reshoring. I don't think it has panned out as much as we had hoped for. So I see reactions, or I would say response to this pandemic at sort of two levels. One is the strategic level that you're talking about, bringing API manufacturers, for example, for the drug supply chain to work well. That's a very difficult proposition because that requires not just bringing manufacturing capability, but also doing it at scale at low cost. And so how do you kind of do that? What kind of incentives would the government require, or what kind of laws would be mandated that you have to manufacture some amount of APIs, the raw APIs here? That, I think, is a national dialogue level that I don't think any one company can solve in itself. The second part of the question that you're talking, and that John alluded to, in terms of partnerships with suppliers or buying manufacturing capacity at a broader level, I think we will see more and more of that. I wish I could say I was very excited about more nearshoring and more reshoring. I do not see that unless we can bring somehow the cost equivalency between what we can get from offshore and outsourced suppliers.
And so, John, let me just turn that question to you then. And Professor Shah alluded to this. Is there going to be something besides cost that's going to drive the decisions, or is cost going to continue to be the preeminent decision in how some things are sourced?
I think that, the pendulum kind of shifted, heavily towards, having cost drive a lot of those decisions, whether it be kind of the just in time, low unit approach, or, where the suppliers were that were being chosen. I think what you'll see more and more, I think, leadership of these organizations are saying, it can't only be cost. We need to, do a better job of supplier, management, and have, better understanding of that. So I think the pendulum may shift back the other way a little bit, at least in the short term. I think that the real question is kind of long term, will it these organizations be able to sustain paying more for products, to have the confidence that, the availability will be there. In some respects, I think, maybe picking their spots in terms of, what products you're talking about. I also think maybe some other creative solutions, and partnering in specific markets, so that you have a group of organizations or a group of partners that are in the chain kind of working together to defray some of that cost and share it kind of across. So, it's more an efficient process than, any one organization trying to take it all on themselves. We saw that, after 9/11, where a lot of health organizations created kind of emergency stocks, by themselves, that, they didn't, manage effectively, that, ended up being, wasted products because of the inability to kind of use and cycle them through in, without the, the emergency event where demand spiked up as well.
So John, I'd like to add a little bit to that. When I said cost being the criteria, I think I want to explain that a little better. It used to be low cost per unit that we just cared about. Now it will be sort of, in my opinion, total cost of ownership sort of idea,
Right.
which includes the idea of, how much is in transit, what kind
It's the
of
cost of the
flexibility.
risk. Yep.
That's exactly it. That's where I was going to, that, incorporating the risk of outsourcing on low cost per unit, I think that will start to be included in the calculation of where should we source from and what kind of production ability, whether it is components, raw materials, and or other types of uh, production that we need to incorporate. I think those would start to be involved and included in the discussion at the highest level. So we'll move away from sort of low cost per unit to a broader discussion of, can I get a safe, reliable, resilient source of supply that does not disrupt my operations, whether it is pandemic or not pandemic.
Great. So the cost concept remains the same, but what cost means is looked at differently, is where you're going with that.
Yeah, or the broader conception of cost that would include the risk part that John is talking about, that incorporates sort of where the suppliers lie, what are the common, where the demand lies. All of that, I think, is in the equation.
And I think we learned the hard way that.
Sorry, John, go ahead.
I think we learned the hard way that just the cost of the product, the cheapest isn't always going to be the cheapest. That, it ends up costing you more in the long run because of not paying attention to the other factors of cost, which is, part of that model about being able to better manage your vendors, and having that effective, information to be able to say, here's what this, in the wrong situation, this could, cost us more in either, lost revenues, et cetera, because of not being able to provide the services. Not to mention the issues, from a community perspective, if, you can't treat the patients that come to your door.
And it has also shown light on the idea that we in the US may be losing on strategic manufacturing capabilities, when we sort of outsource wholesale, 90+% of all APIs are manufactured outside the US. I think there is a real need for this discussion about which of these APIs ought to be here, which of them go into multiple drugs at the end level. So I think that discussion has already started happening, and more of that will happen.
Great. And so this has been a fascinating conversation. And so I guess in closing, and Dr. Shah, we'll start with you and go to John. But, we've talked a little bit about the auto industry and a couple other industries, and then just some general principles that, should be incorporated overall. Are there other things that you just wanted to touch on or mention as it relates to healthcare within its supply chain moving forward?
Yeah, I think, it is very interesting to see, since I study this and at a sort of higher as well as a lower level, meaning at a supply chain level, as well as working with providers, working with distributors. What amazes me is how fragmented this industry is. There is no visibility from end to end from any partner, whether you're working with very large healthcare systems or very small individual sort of providers. There is no visibility in the healthcare supply chain. So my hope is that with this pandemic, we have realized the need for transparency and visibility, integration, whether it is via digital or other means, across the supply chain from end to end. When I say end to end, it means API manufacturers all the way to the patients at the back end.
Yeah, clearly there's a lot of handoffs and fragmentation across the chain. I think that you'll see, more challenging of that, are these valid, handoffs, do they add value to the chain and the process? And, where are the partners that you can count on, that should be incorporated in that? So I 100% agree, Dr. Shah.
Great. Well, again, this has been an immensely interesting conversation. And we clearly could spend significantly more time talking about this. So perhaps we'll need to come back in the next few weeks or few months and revisit this conversation. So again, thanks to both of you today for sharing your expertise and insight with us. And we look forward to speaking with you again soon.
Thank you, Patrick, for
Bobby.
giving this opportunity. It was great fun, and I look forward to a future conversation.
Absolutely appreciate the opportunity. Hopefully it was informative, and look forward to doing it again.
Great. And thanks to all of you for listening and watching to this special episode. And please join us again soon for another episode of the Medical Alley Podcast.